Hi, I'm Dr. Betsy Shapiro, a director with the Practice Institute of the American Dental Association. If you're a podcast listener, you may recognize me as the host of the ADA's Beyond the Mouth podcast. Today, I have the privilege of once again speaking with Dr. Chad Gehani, president of the American Dental Association. As the COVID-19 crisis brings forth personal, professional, and economic challenges for many, Dr. Gehani is here. He's going to answer some questions about the ADA's response and the work it's doing on behalf of dentists everywhere. Like many of you, we're sheltering in place. I'm coming to you from Chicago, and he's coming to you from his home in Long Island, New York. Welcome, Dr. Gehani.
Thank you. Thank you for having me.
Wonderful to have you. The last time we spoke, you were just beginning your term as ADA's president. Boy, what a difference a few months makes, right?
Absolutely.
There's no way any of us could have foreseen the COVID-19 pandemic and its impact on all of healthcare, including dentistry, and of course on everything else in our lives too. Now, about 7 months into your presidency, you're charged with spearheading the ADA's COVID-19 response efforts. Just to give our listeners some context to this conversation, we're recording this on the morning of April 9th. And it's important to note that because the news is shifting rapidly during this pandemic. So, Dr. Gehani, I'd like to start with this question. I know from our previous conversation that you actually have two dental families. You have the ADA, and then you have your own family, which is full of dentists and other medical professionals. How are you all doing personally?
You know, I'm going to tell you, I have three families.
Three?
I have my personal family, which is my wife and my children. They all are dentists. And then I have a dental family, which is the American Dental Association and the whole tripartite, the state dental associations, as well as our component societies. And I want to tell you the third family, where my practice is. I've been practicing in Jackson Heights, Queens. You all have been hearing about COVID in Elmhurst, Queens. That's like 2 blocks from my home. I have not been to my office for the last, I would say, since March the 16th.
Oh dear.
But I do get phone calls from the priest. I get the phone calls from the neighbors where my office is, and they tell me that Mr. X or Mrs. Y passed on, or Mr. So-and-so is now in the hospital. It hits home. It hurts me here. And it hurts me more when I find out that I can't even go to church. I can't even go to synagogue. I can't even go to temple to say their prayer for people who are in the hospital and who are actually, who have passed away, and I cannot pay my last respect. So the last 1 month has been very painful to me. But as a leader, I got to keep the emotions to myself. The good leader shows calmness. And when you see me at the ADA, you always see me calm and relaxed. But when you ask me privately, how do I feel? It has been a tough 1 month for all of us, especially me and my wife personally, because that Jackson Heights neighborhood is really our family.
I so appreciate those sentiments. I think all of us are feeling them, and thank you for sharing that so candidly with us. It does help to know that we are all in this together emotionally, as well as whatever else is happening in our world. At this moment, we're going to talk about you as the president and the leader and the calm voice right now, but
Sure.
what are the American Dental Association's priorities right now?
You know, I want everybody to know that the American Dental Association has our back. At the present time, we want to be the primary resource of all the information to the practicing dental community. And our partners, of course, are our tripartite, the state dental associations and our component dental societies. And they have done a wonderful job working together as a community. We want to pass on the information that is evidence-based, that is science-based, and which is very much factual. We have been in touch with many governmental agencies, and we want to make sure that our practicing dental community is safe. And more than that, we also want to make sure that our public that we care so much for, they have to be safe more than anything else. Many people may not know that we are also at the same time working on the recovery phase. You know, this stage will pass by. And after this stage will pass by, what's next? I'm actually going to name the task force for the recovery today, along with our board of trustees. So our priorities are mixed: to survive now, to get the correct information to our practicing community, as well as we are already working on what do we need to do next.
That is fantastic. And I can say from my end, being on the staff, answering questions, I know the recovery and return to work is a huge
Yes.
topic of concern for our members, to keep public safe, to keep their staff safe.
Absolutely.
You talked about your dental team family, and then themselves, and do the right thing. And I think we'll find a path. I believe we will.
And you also are aware that we are very active legislatively to represent our dental profession in Washington, D.C. And Mike Graham and his entire team has been working, I would say, 24/7. They have been very active in representing the dental profession at the US Congress and at the Senate. And they have done a great job on that.
I want to go back to your first answer when you were talking about your own feelings and emotions and how it's been very difficult. The ADA has some health and wellness resources too, don't they?
Absolutely. And we are actually doubling up our efforts on the health and wellness of not only the dentists, but the dental students and the new dentists, especially our dentists who are now in the training programs like the residency programs. We have been trying to work in different areas to give any kind of support that the dentist can think of, and we want to be available to them.
It's tough. We're all used to being caregivers, and when there's a crisis like this, we want to jump right in and help. But for right now, the best thing we can do is shelter at home and then move safely back into the office.
Absolutely. Safety is more important than anything else.
On April 1st, the ADA issued an interim recommendation that urged all dental practices to continue being closed to everything except urgent and emergency care until April 30th. That's at the earliest right now. We're looking at April 30th. On the same day, the ADA also released interim guidance for minimizing the risk of COVID-19 transmission during these procedures, these urgent and emergency procedures. Can you talk to us a little bit about the process for developing and issuing those items? How does that happen?
You know, the decisions like that, they're quite painful to me. But at the same time, as the leader of our community, we have to follow what is right for all of us, what is right for our patients, and what is right for our entire dental community. There's a process that we follow. We have been in touch with the Center for Disease Control constantly. We have been talking to them almost every day. Sometimes our science division has been talking to them twice a day. We have been in touch with the FDA, and we've been in touch with many governmental agencies. It wasn't the date that we just pulled out of the hat. We have the Division of Science, the Division of Dental Practice, and then we have many other interdisciplinary decisions. And we all sit together and we figure out what is in the best interest of our patients, what is in the best interest of our dental team, and above all, what is most important, for us? Safety. And then we came out to the conclusion that April 30th will be possibly a date. And that's only a recommendation. Each state is different. Each regulatory body is different. The dentist has to follow what is available or what is being asked of the dentist in their state by their state board of dentistry or even the governor's executive orders. So we only recommend what we think will be safer time and in the best interest of our patients first, us, and of course our dental team all together.
It's interesting to hear how that procedure goes, how much work goes into it, and
Absolutely.
yeah, how it comes out in the end. I'm certain that that is not the last bit of information that's going to be coming from the ADA. I sort of have an inside track that they're working on things as time goes by. What can dentists do to stay informed?
You know, I'll speak for me personally. I log on to ada.org/virus at least once a day. And being the president of the ADA, I think I know it all. But every time I log on to ada.org/virus, I learn something new. And the
Okay.
morning huddle, believe it or not, I am waiting to see in my email, in my inbox, that morning huddle. That gives me up-to-date information. At the present time, I think these are two of my best resources where I get all my dental information and I get up-to-date information about what's happening in relation to the practice of dentistry and regulations and everything else. And I would suggest that our colleagues do just the same.
I will confess that I do that as well every morning because as hard as we are all working, we're all on different projects, and sometimes I don't know what's getting completed and it gets the seal of approval and goes out the door. So I have to look in the morning just to make sure I didn't miss anything.
And I occasionally look at the social media, but I ask myself, is that a very reliable information or not? So out of curiosity, I just glance over at the social media, but my best resource is the ada.org/virus.
Excellent. Okay, Dr. Gehani, I don't want to seem disrespectful here, but is it okay that if I recognize that you're one of our more seasoned or experienced colleagues? You've been around for a while?
You're trying to say I'm an older dentist. I have
I-
been around for a while.
I'm
Yes,
saying you have experience. So,
yes.
as an experienced practicing dentist, to an audience of practicing dentists hoping to be back into their offices soon, what advice do you have to your colleagues out there?
You know, I was trained at Columbia University in 1977, 78, 79. And I was trained to perform dentistry with bare hands. There were no gloves, and we occasionally used a face mask when we did periapical surgery or some challenging surgery, or if we worked in the OR, at that time we wore masks. At that time, if somebody had hepatitis, that was the end of the world.
Yeah.
Okay. Then when I started my practice in 1981, 82, we got the so-called huge thing, what we call is HIV AIDS at that time. And we didn't think that we will survive that era at that time. We survived that. The only thing that happened is the practice of dentistry got slightly modified. Instead of working on the patients with bare hands, then we started wearing the gloves and the mask, and we wanted to wear the aprons or the gowns. But we survived. The practice of dentistry slightly changed. We have been hit with the this pandemic, which has been hitting us like tsunami. Every day there's a new news. It's a moving target. This will pass by. We will see good days at the end of the tunnel. Of course, the practice of dentistry may slightly get modified.
Mhm.
I don't know what's at the end of the tunnel, and that's where the ADA is working hard. Our science division is at the hard work with CDC. Of course, you belong to our recovery team, and you know what we have been trying to do at that with the team, and we will come out great with a slight modification.
I think I too was working in a dental office. I wasn't a dentist yet, but in the 70s, no gloves, no nothing. Went to dental school, and when I left, we wore gloves and a mask. And I can remember some of the more seasoned dentists at that point in time saying, I'm never going to be able to practice with gloves. I can't feel. I need to be able to feel. And heavens, now we wouldn't touch a patient without gloves on, nor would a patient want us to touch them without gloves on. We're an adaptable lot, aren't we?
Yes, and dentistry is very resilient to any obstacles that are put in front of the profession. As a profession, it's a great profession. And if I have to do it over again, I will again want to be a dentist.
Dr. Gehani, thank you for chatting with me today. I really like the feeling that although we are all apart, as you pointed out, we've never really been more together as a profession than we are as we move through this.
Yes.
Thank you for all you're doing to lead the association on this issue, and I hope that you and your family continue to stay well and stay strong.
Thank you for having me, and I wish everybody stay home and stay safe. Thanks.
To access the ADA's COVID-19 resources, as Dr. Gehani mentioned, visit ada.org/virus. Be sure and bookmark this page and visit often, as updates are made very, very regularly. On behalf of the American Dental Association, I'm Dr. Betsy Shapiro. Thank you for listening, and stay healthy, everybody.